Good afternoon, ladies and gentlemen. I'm Paya Nouko with Cedars Diagnostics Center, which is a social enterprise based in Kenya. Well, I grew up in one of the biggest slums in Africa called Kibera, in a household of 5 siblings under the care of our parents. Well, you all know that healthcare outcomes for mothers and children living in the slum is actually the worst. For a typical family like ours who used to live on a budget of under $1 to $3 a day, we simply could not afford these particular services. Now, Cedars Diagnostics' main mission is to provide or create access to quality and low-cost diagnostic healthcare services to the Kenya's poor. Now, 70% of procedures done in a physician's office actually require radiology to fight cancer, trauma, communicable and non-communicable diseases. And on a national level, 65% of the Kenyan population do not have these radiology services, maybe because of non-affordability or inaccessibility. Radiology is also a costly affair. It requires purchase of sophisticated and expensive equipment which require constant maintenance and management. Currently, we have about 200 radiologists serving a population of 50 million Kenyan inhabitants. That's a huge disparity. And because of all these inequalities, among others, we have maternal mortality rate standing at 5 deaths per 1,000 live births, and perinatal mortality rate standing as between 35 to 100 stillbirths per 1,000 live births. Now, Cedars Diagnostics was founded on the sole purpose of trying to address these inequalities to create better healthcare outcomes to the bottom of pyramid of Kenya. And how do we do this? We do this by simply providing medical imaging services to the bottom of pyramid at low cost. We also actively conduct outreach maternal screening to reach pregnant women in the remote regions. We also leverage technology in image transfer by employing teleradiology to enable remote radiological consultations. So far, we have managed to screen, test, and diagnose over 33,000 patients. We have also managed to reach over 8,000 pregnant women in the remote regions through our outreach programs. We have saved about 800 pregnancies through early diagnosis of pregnancy-related conditions. We have also saved 300 expectant women through early diagnosis of fetal life-threatening conditions. We have also actually diagnosed 900 children, which was very critical in their disease management. And currently, we operate in 8 healthcare centers through this collaborative partnership to offer these particular medical imaging services. Now, our business model is mainly revolves around private PPIP, as our panelists talked about this morning. Could be private-public or even private-private, can go either way. Now, over the last 3 years we have been in operation, we have developed a process on how to identify or how to scout and how to engage and how to form a collaborative partnership framework so that we can offer these particular services to the healthcare centers that cannot offer these services. A good example of a healthcare facility that we are in partnership is healthcare facilities run by the Seventh-day Adventist Church. We target involvement in at least 60 healthcare centers or hospitals in the next 5 years to come. But our main target is actually trying to partner with the county government hospitals. By the end of 2017, we generated a revenue of 1.2 million US dollars. And in the next 5 years, we project that we would, by the end of 2020, we project that we would generate a revenue of about 5.2 million US dollars. And I'll have you know that for a typical radiology facility, it takes 30 months to break even. And that being said, we require 1.5 million US dollars in grants. From the 1.5, we intend to use 1.1 US million dollars to set up 2 radiology facilities, which will cater for remodeling and setup costs, and also at least 6 months operation. What that will do, it will help us reach a much quick cash break-even point. Remaining 400,000, we intend to use it to enhance our maternal screening outreach programs to potentially reach 12,000 pregnant women in the remote regions annually. We also intend to use it to carry out research about the inequalities of radiology or diagnostic healthcare in Kenya. And finally, we also intend to use it to hire key staff members to support our growth. Behind it all is a team of like-minded individuals with financial, marketing, technology, and clinical backgrounds. Radiology saves lives, and at this juncture, I would like to urge you to please join us in this accelerating venture to save more lives.